Hi, Lawrence LeBrocq, Managing Partner of Garces, Grabler, and LeBrocq. Welcome to Victim to Victory, the authority in personal injury. Today we have another authority in the industry. This is Dr. Blessen Abraham. He is a chiropractor. He not only practices in New Jersey, but also in Pennsylvania. Besides being a chiropractor and specializing in musculoskeletal injuries, such as herniated discs, he also owns a pain management company in Pennsylvania. So we're going to talk a little bit about not only chiropractic and injuries of the spine, but also the business of law, how it relates to owning various practices and running a business through the industry. And we're also going to talk a little bit about PIP law. So let's start off, Doctor. Please, could you just tell everybody what is chiropractic?
Hi, folks. Now, chiropractic is essentially a treatment and medicine function of health where we try to treat the patient holistically. We try to treat the patient with no medication, with our hands and other various instruments and tools.
So why is it important? People hear about adjustments and manipulation. What is the whole idea? And I know you do a lot of different modalities other than just adjustments, but what is the idea or the principle of why you adjust somebody?
Well, the spine works on joints, and sometimes the joints gets misaligned. So the misalignment happens, and then your body is now trying to accommodate the misalignment. So the adjustment comes in, and we try to reset the joint, get it back into normal function, so the patient or the person can go back to their normal daily activities.
And now there's a lot of pain involved in the muscle spasms. If somebody's joint is out of place, there seems to be a spasm around that area. Why does that spasm occur?
Because now the muscle is being pulled in an abnormal function, an abnormal way. So the muscle now is being pulled, the spine is now being contracted in a different way to cause pain. So that's why when we reset it, the muscle goes back into its normal place.
Now, there's also different modalities that you treat for muscle spasm and back injuries. Just talk a little bit about the physical therapy that's also offered in conjunction with chiropractic treatments.
So in conjunction, we do the physiotherapy, which consists of TENS units and stim machines, which not breaks down, but actually reduces the pain sensation. Now, we also do ultrasound, which brings heat into the muscle, reduces the pain sensation as well. And then we can also use different other modalities as sonic and laser as well.
Now, how long have you been practicing as a chiropractic doctor?
I've been practicing for over 20 years.
All right. And where do you have offices now?
I have an office in New Brunswick, New Jersey, and one in Philadelphia, Pennsylvania.
Okay. Tell us a little bit about the differences of your practice in New Brunswick, New Jersey, and your practice in Philadelphia.
So in New Brunswick, we have chiropractic, physical therapy, we have acupuncture, we have physical medicine rehab, and pain management. In Pennsylvania and Philadelphia itself, we just do pain management alone.
All right, so now we've talked a little bit about chiropractic medicine. Now let's talk a little bit about pain management and first of all, what is pain management?
Pain management is the treatment of pain with medication or procedures, essentially, to make it simple.
So just to make this very simple, if somebody is not responding properly to the different modalities that you're giving them through your chiropractic and rehab, then the next step may be pain management to reduce that pain.
Correct.
All right. And so I know they use medicines, but what other types of techniques are used for pain management?
Well, there's also injections, which include simple as salt water, or they can have lidocaine, which is like a numbing agent, or some kind of cortisone that can also reduce inflammation to the body.
And different areas can be treated with a cortisone or a different type of...
You can treat from the elbow all the way into the spine, to the knee, to the hip. There's not a joint you can't treat.
Right. I was just at a conference down for a group called PILMA, which is Personal Injury Legal Marketing and Management Association. And one of the people there had to go to see a pain management doctor to get a cortisone injection because they're trying to stem off a knee replacement as long as possible, and they seem to get about 6 months of relief from the cortisone injections.
Every patient, every person has a different reaction to cortisone. Some people can last 6 months to a year. Some people can only last maybe a week. It all depends on how their body takes to the cortisone. But it is a good Band-Aid.
And then I know from my own experience, if you have a cortisone injection and you need to have a replacement, whether it's a knee or a hip, you have to wait about 6 months. Is that
Correct.
right?
It's average that surgeons like to wait some time to get that out of the system.
And why is that?
That I couldn't tell you. I'm not real. I'm going to leave that to the medical doctors on that aspect.
Okay, that's fair. Now let's talk a little bit about PIP. And what PIP is, it's called Personal Injury Protection, PIP. And that in New Jersey is where you get your medical bills paid through your auto insurance carrier if you're injured in a automobile collision. So now you had to become very familiar with PIP because I know you do. Not only do you have your practice, you have your normal patients, and then you also have your patients that have been involved in an acute trauma or automobile collision.
Yes.
And what are the differences in how you treat that for billing purposes?
Well, the beauty in the state of New Jersey, they give us guidelines on how to do this. So when you have insurance, you have coverage through your carrier or through your personal health insurance. But regardless, you have rules set up by the state for the insurance carrier to follow and the provider to follow. So our job is to get you better by following those rules. And they're set rules. There's no variation that you can make from the rules.
And those set rules are the care paths that they set up in.
They have multiple care paths saying if you have this, this, and this, you must follow this route. And the same way they have another care path, you have to follow certain routes. But we have to get permission from the state, from the insurance carrier, by showing our paperwork, showing them, what the pain is, where the range of motion is, what the complaint is, and we ask for a certain amount of visits or a certain kind of treatment. And with their staff and their doctors, they see if it's worthwhile or not.
So anybody who's injured in an automobile collision, you have PIP with your auto insurance policy. Now, there's different limits. Some people have only $15,000 in PIP, but the normal coverage and the coverage we always recommend is $250,000 in coverage. So, and then you're paid according to the fee schedule in PIP, which is different than what you would be paid through medical insurance coverage.
Correct. So if my bill was X, Y, and Z, my bill would only be X or Y. It would all depends on what the fee schedule that the state makes up for it.
Right. And then once you go over the PIP fee schedule, once you hit that $250,000 mark, then it goes to what you would normally bill through the medical coverage. Those rates would then apply.
Correct.
And that's what's called the usual and customary rate. So when you're involved in a collision in an automobile, PIP will cover according to the fee schedule set up by the state. And then after you get over the fee schedule or the amount of $250,000 in medical coverage, then it's what's the usual and customary rate in the industry. And what's interesting about that, Blessen, you know as well as I do, is that you can't testify as to what the usual and customary rate is in
Correct.
the industry.
Correct.
You could testify as to what you charge.
That's all I can testify to. I
But-
cannot do anything else.
But the problem is that a doctor such as Blessen Abraham doesn't know what every other chiropractor in his particular area or county is charging for the same procedures. So that would be considered the usual and customary rate is the average that's charged by chiropractors for certain modalities. And that's what can be charged to the patient once the PIP is exhausted. I know that sounds a little complicated,
But it's direct to the point.
but that's how it is. And we're trying to teach you and educate everybody, since we are supposed to be the authorities in personal injury, about how this is billed. In a trip and fall, a construction accident, there may be workers' comp if they were working during that.
That's a whole other aspect. They can, then if they have workers' comp, it just brings up an avenue to go down to get paid.
Right.
So the patient doesn't have to worry.
So people understand that if you're injured on the job, even if it's an automobile collision, so you're working for X company and you're making a delivery and you're injured in an automobile collision, your workers' compensation insurance is who's going to pay your bills.
Correct. At that point, you don't even go through your health insurance or anything else. You go through work. It's a job-related injury at that point.
And that's your primacy of coverage, which means injured on the job, first workers' comp will pay. If there isn't any workers' comp insurance, which there should be, then it goes to your medical. And if it's an automobile accident and you're working, it's workers' comp, then it's your PIP through your automobile, then it's your medical, then it would be a letter of protection. So these are things that are very important in the industry to make sure that not only you're getting paid, but a client isn't ending up with a huge bill, that it's billed to the correct carrier.
Correct.
So now you do a lot of workers' comp work as well.
We do. We do.
And now that's a whole different way of getting paid. Explain a little bit about if somebody's injured on the job.
Well, in New Jersey, you have to be on the panel to get approved to get paid. That's one thing. Chiropractors are usually not approved on that panel. So what we'll do also on that one is we'll get a letter of protection, or sometimes the insurance company will approve it just because there's no authorized provider or doctor that's in that patient's area. So at that point, we have no choice. They have no choice but to pay us.
But even if they're not treating with you or one of the other chiropractors on staff, you could still use the physical therapy.
Correct. So the physical therapist will still get paid. That point, the insurance company will direct the payment and the treatment of the patient at that point. They'll go to the insurance company doctors, and then they will direct the treatment to whatever therapy location is good for that patient at that point.
Now, there's a lot of lawsuits. The insurance companies, in whether it's an automobile collision, a construction accident, or a trip and fall, they love to claim neck and back injuries. Spinal pathology is degenerative in nature. How do you attack that argument that comes across on every case? It's if they can't say it isn't there because it shows up clearly on an MRI, they claim it's degenerative in nature. How do you combat that?
Well, simple is the patient was pain-free prior to the date of injury or to that moment of injury. So at that point, the patient was asymptomatic, and all of a sudden the patient was involved with some kind of work injury or car accident or fall, and all of a sudden they have pain. And then you find out on the MRI, here it is. The patient all of a sudden has an issue, and now we have to treat that issue. Prior to that, patient was no pain, pain-free, living their life carefree. So that's the way we have to fight it usually.
But now there are some types, especially in workers' compensation, where you can get injured from repetitive motion.
So when it's repetitive motion over time, it's going to build over time. So let's say you are a forklift driver. Well, that forklift driver is getting impacted in their spine nonstop, and now you're going to start feeling patients starting to build the compression of the spine over time, maybe causing a disc herniation or a disc bulge. And it's not an instantaneous injury, but it could take months and years to form that injury.
Now that you mentioned the spine, let's talk a little bit about those various injuries. Can you just define a bulging disc?
Essentially, make it simple. You got a jelly donut, and when you squeeze that jelly donut, you could see that jelly coming out of that corner. That's essentially what that disc bulge is. The disc essentially is the shock absorber in the spine. When we walk, this disc compresses and decompresses as we walk. Now, a disc bulge is when the disc actually is compressed and stays compressed. It does not decompress. And it could push maybe against the nerve or the spinal cord at that point. Now, then the next step is the disc herniation. Now, the disc herniation is when the disc is being pushed down so much that it's actually leaking out and pushing out. Now, it could push against the nerve. It could push against the spinal cord also. So if you want to take a picture of it, essentially take a jelly donut, squeeze it down. Now you get the jelly donut leaking. That jelly donut could be pushing, that jelly could be pushing against the spinal cord or something else and causing the pain.
Right.
So that's what the disc herniation is. And that's a permanent injury. So is a disc bulge. They're both permanent injuries, and that's something that can't be fixed overnight.
Right. And just tell me if you agree with me, because I've explained this to many, many jurors over the years, is that the nucleus pulposus, which is the jelly of that jelly donut, and the annulus fibrosus makes up the dough portion of the donut. Now that dough portion, it's a strong ligament.
Very strong.
I actually try to describe it as it's almost like the plastic on those 6-packs of beer, is that once you tear that, it's never going back.
Never going back. It's stretched and broken at that point.
Right. And it's just a matter of trying to get the relief. So if somebody has a herniated disc and that disc material is extruding into the spine or into a nerve root, the treatment then is an epidural to try to relieve some of that pressure.
That will reduce the pain pressure there, yes.
But you can't fix it with an epidural.
No, essentially it's just a Band-Aid. That's all
Right.
it is.
I've described it. It's like taking an aspirin for a brain tumor. It's not going to cure the problem. It's just going to alleviate some of the pain.
Correct.
And then if the pain management techniques don't work, then what do you do?
At that point, we'll refer to a spinal orthopedic surgeon because that essentially is the next step. And at that point, the surgeon will discuss with the patient their options depending on the kind of injury.
Now, we talked a little bit before that you also own a pain management facility in Pennsylvania. And now this is very nuanced in the legal industry. Now, medicine has been doing this forever where doctors don't necessarily have to own medical practices. They have to perform all the medical, and they have to perform the medicine and do what doctors do because non-doctors can't tell a doctor how to practice medicine.
Correct.
Now, in New Jersey and Pennsylvania, law firms have always been owned just by lawyers. And now we have something called an MSO coming in, which is a managed service organization, in which they can buy into a law firm and do everything except the practice of law, which, I mean, Concentra basically does that in the medical. There's several other companies that do that. So explain a little bit about how you can control a pain management facility or own that business.
Well, I don't control the doctor directly. What I do is control how the business runs. I'm essentially the back office. I'm the one making sure the front desk is running, making sure the patients are getting treated right. Essentially, I am the one making sure everything in the kitchen is cooking right. Essentially, you're going to compare it to a restaurant. So at that point, we're making sure the notes are being taken care of properly. They're getting distributed where they need to be done. They need to be completed. Billing is going out. So essentially, I'm not treating any patients. I have no idea what the patients are getting done. I have no idea what's going on, but I'm taking care of all the staff. I let the doctor do his job, what he's good at. Essentially, that might be what the MSO you're talking about, where they let the lawyers do what they're good at,
Right.
let someone else handle the back end stuff.
Right, all the back end from marketing,
Hiring, everything. Supplies, all of it. Insurance, payroll, all that stuff.
IT, everything that's not related to the practice of medicine.
Right.
And is what you're doing. And now it's, like I said, it's a nuance. It's something that's brand new in the legal industry. And we're going to have on a gentleman in a future program named Dudley DeBosier, and he's going to talk about the MSO that he just brokered down in the state of Louisiana. So it is something that's coming. There's a lot of private equity money that is coming into the legal industry to form these MSOs because they know how to do operations very well and handling the back office. So it's interesting that you're doing that. You're basically your own MSO.
I've learned that I cannot be the jack of all trades. I can only be good at what I can do. And if I spread myself too thin, I can't do it right. Same thing with you.
Right.
You can run your practice and be a lawyer, but one has to give. You can't do both great. So that's why maybe the MSO is the new way to go with all these new ways.
So Dr. Abraham, and I do call you Dr. Abraham because you're a doctor of chiropractic medicine, not a medical doctor, and I think you deserve that respect.
Thank you.
And you've been doing this for over 20 years now. It's a long period of time to be a chiropractor, owning your own business both in New Jersey and in Pennsylvania. What changes have you seen in the industry in the last 20 years?
In the industry in the last 20 years, I've seen practices come and go. I've seen practices join to become bigger groups and stronger groups. I have seen insurance companies be much more aggressive with patients and clients, trying to say they don't have injuries. And then I've seen firms go from small 2-man operations to 200-man operations. And it's changed. Every year, something changes new. Usually all for the better, but there have been times where Essentially, the fee schedule is one example for New Jersey. Doctors are always weary of what the new fee schedule is going to be because, prices go up, but our prices go down.
Right.
The inflation goes there, but it doesn't reflect in our payments.
Well, I think you and I were actually at some political meetings where they were discussing the PIP fee schedule.
Yes.
And the insurance lobby was trying to bring those prices down almost to where Medicare and Medicaid is.
Actually, Medicaid, and it was insane what they were asking for.
Yes. Because then doctors are not going to want to treat people that are involved in automobile collisions because they're not going to be able to make any money. They're not going to make ends meet.
They won't even cover costs for staff or machines or any kind of treatment. So if they were going to treat, they're just going to get the bare basic minimum treatment.
And that's something that people don't realize because the insurance lobby has such a huge marketing budget that they're always claiming, they want you to think that things are fraud, it's just mayhem, they're accidents. But they are fighting tooth and nail in the political arena to cap lawsuits, to reduce what doctors can get paid when somebody's injured in an automobile collision. It's really a fight that the doctors and the lawyers in New Jersey have to really bear to protect their patients and clients.
Well, that's what helps out with the MSO program or with the MDDC program, where one person can concentrate on the business side and let the other one worry about the patients.
Right.
Yeah.
And that's very true. Any other changes? One is you were talking about the consolidation in the industry, and that's what we're seeing. We're seeing almost the Walmart effect now coming into the medical and the legal industry, and a lot of the prognosticators are saying if you're not a $50 million a year law firm, you're not going to be in existence in a few more years because you have the bigger law firms coming in, taking up so much of the marketing share because they can spend so much money on marketing that all the cases are going to go to the bigger firms.
Well, the same thing as the medical. The bigger the groups are, they have all the money to market, but the treatment comes down, and the treatment gets a little bit not as one-on-one as a small mom-and-pop operation.
Right.
Most patients I can say by their first name. A lot of these big industries, they have no idea. You're just a number.
Right.
And probably the same thing in your legal practice. You could probably see that in, not your practice, but in some of these big operations, you get lost in the way.
They do. And you hear a lot of complaints, not only from patients, but from clients because they never hear from their lawyer. Mm-hmm. And it's just some common sense. I've been in this industry now 35 plus years, and when a doctor calls me, if I have a procedure or something done and a doctor gives you a phone call, you think, oh my goodness, man, that's great that doctor actually called me. It means so much just to be able to speak to the person that's taking care of you, whether it's in the medical field or the legal field. And sometimes that gets lost with the size.
It does, and you could probably see it with your own clients. I see it sometimes with my own patients that when I talk to them, you see a little bit of light, like, oh, I really do matter to them. They remember, or they know who I am. They actually feel my pain.
Right.
It makes a difference. It makes you think about it like your own family going through the same thing. You want to treat your patients or your clients like it's one of your family members or friends.
It's very true. And we'll see what happens in the industry if the MSO model comes in and takes over the legal profession, as it's doing a lot in the medical profession. But it's great to see how you formed your own MSO and you're working in Philadelphia where you own a pain management company and you're handling all the back office and allowing the pain management doctors to practice medicine. So that's an incredible situation, very good businessman. And I want to thank Blessen Abraham, who's an authority in the industry, not only in the world of chiropractic, but how to run a business in the medical field. Thank you for your time.
Thank you, sir.